How does pulmonary embolism affect oxygen levels after surgery? Have you ever wondered how a blood clot can impact your oxygen levels after surgery? Let's break it down in a way that's easy to understand. Pulmonary embolism is a condition where a blood clot blocks one or more arteries in the lungs. This can happen after surgery due to factors like immobility or injury to blood vessels during the operation. When a clot blocks blood flow, it reduces the lung's ability to transfer oxygen into the bloodstream. As a result, oxygen levels in the blood can drop. This leads to lower oxygen saturation, which is the percentage of oxygen in your blood. Normal oxygen saturation is usually 95% or higher. If your levels fall below this, it may indicate that your lungs are not functioning properly due to a pulmonary embolism. After surgery, healthcare providers closely monitor your oxygen levels. They often use a pulse oximeter, a small device that clips onto your finger to measure your blood oxygen levels. If there is a sudden or persistent decrease in oxygen saturation, it is essential to act quickly. Early detection of low oxygen levels helps diagnose pulmonary embolism promptly and allows for immediate treatment to prevent complications. The drop in oxygen levels occurs because the blockage in the pulmonary arteries increases resistance in the lungs' blood vessels. This creates a mismatch between ventilation, which is the air reaching the lungs, and perfusion, which is the blood flow in the lungs. This mismatch means less oxygen enters the bloodstream. Additionally, the increased pressure from the blockage can strain the right side of the heart, further reducing the amount of oxygen delivered to the body. In immediate post-operative care, balancing early mobility and rest is vital. After surgery, being immobile can increase the risk of developing deep vein thrombosis, which is a blood clot that forms in the legs. If these clots travel to the lungs, they can cause a pulmonary embolism. Therefore, healthcare providers encourage movement as soon as it is safe to help maintain blood flow and oxygen levels. If you notice signs of low oxygen saturation, such as shortness of breath, chest pain, or a rapid heartbeat after surgery, it is crucial to inform your healthcare team. They will evaluate you for pulmonary embolism using imaging tests and blood oxygen monitoring. Treatment may include blood thinners and oxygen therapy to restore normal oxygen levels and prevent further complications. In summary, pulmonary embolism can significantly reduce oxygen levels after surgery by blocking blood flow in the lungs. Close monitoring of oxygen levels and encouraging early mobility are essential strategies in post-operative care to detect and prevent this condition.